Hello and welcome everyone to episode 3 of our podcast, Teen Talks Adolescent and Their Unique SRHR Needs. Today we delve into a topic that's extremely relevant for today's adolescents, their unique sexual and reproductive health and rights needs. Let's kick off with a series of insightful questions that shed light on this area. Joining us today is esteemed guest Dr. Samina Khalid, an expert on HPV and a dedicated consultant for the WHO Pakistan. So thank you so much, Dr. Samina, for being on the show. So to set the stage, we need to begin by understanding the basics. So I would like to ask that what is SRH information for teens?
Before I start talking about SRH information, which when we actually elaborate it as sexual and reproductive health, it is usually a taboo in our setting, especially in the countries where there is conservative environment. Let's first define what are adolescents. These are the ages from 10 to 19 years, and these are the ages when puberty occurs or growth spurt occurs. So we need to understand that what are the physiological and anatomical changes which occur. So if we say that it is actually about health and it is sexual and reproductive health, that means that physical, mental and social well-being of adolescents and of their sexual and reproductive health, that is what WHO defines. So sexual word, it is a little taboo in our setting, but when we say SRH, that is a rather acceptable word.
Right. So moving forward, when we speak about the health of our teens, a question arises, and for that, I would want to ask you that what are common diseases of adolescents and young girls and boys?
There are two growth spurts which occur. One is for the baby when we are breastfeeding and the baby is growing in the first 2 years of life, and the next growth spurt occurs at when they're 8 to 13 years for girls and around 9 to 14 years for boys. This is the growth spurt period when they have specific nutritional needs, and if they do not find, actually, you know, the kids in our country, they are too much on these fast foods and unhealthy eating habits. There are puberty changes, there are hormonal changes which occur, and because of these eating habits, they get a lot of hormonal disturbances, especially in females. And then they have to know about the personal hygiene, because if they're not aware of it and if not, they are not taking care of it, they get problems about their personal hygiene, menstrual hygiene, hormonal changes and growth spurt. They have different feelings. We need to understand about those, and definitely because of this, there are sexual diseases, and there are a lot of sexual diseases like chlamydial infection, gonorrhea and other infections, HPV, and definitely there are psychological issues as well.
So you just spoke about HPV, and it is a term often used, but not fully understood by others as well. So I would want to ask you that what is HPV, and why is HPV vaccinations needed for young girls and boys?
Actually, HPV stands for human papillomavirus, and we do not try to understand that HPV vaccination actually prevents from a cancer. The thing is that it is a disease which causes cervical cancer in females and penile and throat and head and neck cancers in males. In our society, we are not really ready for screening the way we have started screening for breast cancers. We should start screening for cervical cancer, especially the females who are 40 years and above. So this is a vaccination which prevents from a cancer. So this is very important that teens, they know, because these are the age groups when they are school going, 9 to 14 years of age, they should get vaccinated for HPV.
Right. So every individual has their unique needs. So the question is that how can we like ensure that the sexual health program is like inclusive and addresses the needs of adolescents?
Actually, the program should be the way I told you, that the program should be specific for the area, geographical location, and what are the cultural values, what are the family values, what are the language sensitivity in that area. I'll give you an example. If we use the word miscarriage, that is acceptable in our community, but if we use the word abortion, abortion does not mean that it is always induced or it is always unsafe. But we need to be very sensitive about the language, what we want to teach the kids. Actually, at this moment, what we are trying to actually give the information to the kids is that they should be saved from all these issues. They should be protected from STIs, and they should be protected for any abuse, sex abuse for them, whether they are exposed to their peers or whether they are exposed to the general public. We want to save them. It is not that we are talking about something which is not acceptable in our community. I'll go with the Quranic verses, and I'll talk about that. Our religion actually tells us what is sex education. I always say that our book, Quran, is a complete reproductive health book if we look at it. So we should be open about it. We should be talking to our teens especially, and it is the responsibility of parents, for teachers, educators, and all the media, I guess. Media platforms should be used. Actually, we use, especially the social media, we use it for negative things. So I think that our programs should be focused, should be sensitive for the area, should be age specific information. I do not want to give information to young kids about adulthood. I think that adulthood is something where they are mature enough that we cannot change their mindset. But this is the age period when things are changing, and if we give the right information, kids are receptive, they are very smart, they are intelligent, and our programs should be inclusive of all the information. All the stakeholders should be there, and the parental consent and parents should be involved. I think that whatever, you know, that we have like 60% of the population who are young adults, and if we focus on them, if we give them right information, if we train them for different programs and for professions, we can get benefit at the country level.
Right. So pivoting a bit, let's talk about like delivery methods. So how should we provide SRH education to adolescents?
I think that one of the forums is in the schools. I would say that the way I was talking about HPV vaccine, we can introduce the vaccine, but we cannot just introduce it. We'll have to go and tell them about these things. I had been raised, I had been studying in a very good school, but I have never been given information about menstrual hygiene. Now I feel that schools are playing their important role, and they are giving information to the young girls how to actually cope with it, because it starts early. You know, there are environmental changes, changes of the dietary patterns, changing in the sleep patterns. All these, if we are not actually sleeping appropriately, if we are not taking good sleep in the night time, you know, hormonal changes occur. There is growth spurt which occurs. There are growth hormones which should release when you are sleeping, and it should be like good sleep, 7 to 8 hours sleep. So if we are not actually conveying information to our young adults, if we are not giving them, and schools is one of platforms, parents should be actually the parents who plan to have a baby, they should be told, the parents whose kids are growing, and even I think that the kids at school and the kids when they come in our community, there should be different forums. Girls should know about what the boys' rights are, and boys should know about girls. I mean, whatever Islam tells us, that this is a mutual process.
Right. So now a very touchy subject, but of utmost like importance. What are the methods of contraception for sexually active adolescents include?
Actually, I have worked in my field, and I have seen that in certain areas there are young girls who get married, and when I ask them what method of contraception you plan to use, and they are not really aware. This is very surprising. They are not aware of the methods of contraception, and when I ask them, what are you planning, how you are going to plan your pregnancy, and she says, whatever my husband says. If my husband says that you should get pregnant after 6 months, I'm ready to do that. Which I feel is that we need to empower girls. They should know about these methods, and they should know that there are, of course, condoms are there, and there are oral contraceptive pills. There are methods like long-acting reversible contraceptives.
Exactly.
There are patches. There are injectables, and whatever suits. They should actually seek counseling from healthcare provider and get the right information. They should get the right information from the right person actually.
Right. So, what are the common sexually transmitted infections among adolescents, and how can we educate them about prevention, testing, and treatment?
Actually, previously the young adults were not really aware of these problems, but now since they are exposed to social media, exposed to information on TV and all these the people like you and all other educational institutes, they are working on these, and they are giving information to them, and I am surprised to know that they come to us, and as healthcare providers they ask us that we are planning to get married, and can I be tested for STIs, and I am really surprised that this information is getting to these young adults. And also, if they do not know that, if they are not behaving in the cultural manner that Islam doesn't allow to have sex with multiple partners, and if they are aware of these things, they won't be exposed to these infections. And these infections, they are usually how they actually feel about it. They get urinary problems, they get problems with sexual relationship, the females have got painful sexual intercourse, and they have all these problems. If they are having these, females get the vaginal discharge, and usually these infections are from chlamydia, gonorrhea, syphilis. These infections are usually present in these couples, and especially it doesn't, I think that if they are wisely using methods, like we tell them, if they are not planning to have a baby, they should use condoms. So if they are not practicing these safe practices, only then they get infections.
Thank you so much for that insightful information. So let's not forget the psyche as well. How can we educate adolescents about the emotional and mental health aspects of growth and promote their overall well-being?
And the way I told you that there are hormonal changes, the kids when they are in adolescence, especially when they enter their teens, that is a very risky period, because they feel that everyone is wrong, they are the only one who are right. They have the right information, and parents, they have all the old information, they are updated and they are well informed. I think this is not right always. We should stick to our traditions as well, because otherwise we won't be mentally stable. What I have felt being a Muslim is that we feel stability, because we feel that a lot of things are going to be taken care of by our Lord or by God. I always feel that our hospitals lack services for this age period. If you go, you have a pediatrics department, and then all of a sudden there is a gynae and obstetrics department. If we want young adults to be productive in later life, they should have strong mental health, and for that we should have a supportive environment in homes. Parents should try to realize that it's not their fault. It is because of the hormonal changes that they have anxiety, depression and issues, and issues of getting angry, all of a sudden mood issues. So if they are doing it, and also there are sleep issues. If you agree with me, the young girls and boys, they sleep a lot and they sleep on in an erratic manner, which should be understood by parents. And I feel that is the time when you should feel that there is something wrong. Instead of scolding them, they should give them support, give them your love, give them your attention, give them your time. This is all. They not always need money. They need your support, they need your understanding. So I think that they should be taken into account for mental health issues.
Thank you so much, Dr. Samina. It was so insightful. So now moving to our most interesting part, and it's the last part of our show, is rapid fire. So Dr. Samina, are you ready?
Yes. Okay, I'm going to get a gift hamper after that.
So you got 10 seconds to answer. Puberty education or learning by experience?
Puberty education.
Contraception or counseling?
Counseling.
Peer pressure or awareness?
Awareness.
Knowledge or experience?
I would go for knowledge, although both are needed, but knowledge.
All right. Consent or misinformation?
Consent.
Pregnancy or prevention?
Prevention.
Rights or ignorance?
Rights.
Support or isolation?
Support.
Education or taboo?
Education.
Safety or risk?
Safety.
Parents or peer guidance?
Parents.
Emotional or physical health?
Both.
Okay. Advocacy or silence?
Advocacy.
Thank you so much, Dr. Samina, for being on the
you.
show. It was lovely having you. As we wrap up this episode of Teen Talks, I want to emphasize how crucial it is for us to understand and address the unique SRHR needs of our adolescents. Through open dialogues, expert insights, and the collaborative sharing of knowledge, we can collectively work towards ensuring a safe, informed, and empowered journey for our youth. Thank you for listening to us, and we'll look forward to continuing this conversation in future episodes. Until next time, I'm Areeba Ahmed, and you're listening to the Bridging the Gap SRHR Conversations. Stay safe.